Lovely. So, hi everybody. I'm Riddhi Doshi Patel from Mumbai. I'm a practicing child psychologist, a mental health practitioner, and I believe I can bridge the gap between a parent and a child. Thank you.
Thank you, Riddhi. This is Dr. Amrita Vohra. I am the Director Education for GEMS Education India, and we have schools all across the globe. And I'm also the principal of GEMS International School, Gurgaon. And yes, a practitioner of education, but with education, child psychology and everything else comes like a package deal. So here I am. Let's move on to Kavitha.
Hi, I'm Dr. Kavitha. I've done my PhD in education. I've been with Edify Education for about 15 years, have schools across the country. Very, very passionate about being amongst children and working with them. And that's the reason I'm here.
Let's hear it from Basanti.
Hi, good morning, everyone. So I'm Basanti Caroline, and I'm the director of Total Child Protection and Empowerment, which is an NGO working for underprivileged children. We have homes for children, we have outreach centers, and I'm a social worker. So obviously, mental health is my very, very first concern.
So I think we can start with what are some of the changes that we've seen. I think Mr. Amol is finally there. So let's hope we can. Yes, you are. Here you are. So we've quickly just introduced ourselves, Amol, in the meantime, and I think you can take it forward from here.
Yes, thank you. Thank you so much. Sorry for the late arrival, some technical issues. So I'd like to first of all ask you, Amrita, what have you noticed in the changes that children are now back in school? So what kind of changes have you noticed among children who come to school in terms of their development apart from the curriculum loss that we've had?
Thank you, Amol. And I think more than the children, also the teachers. The very idea of talking to people and working with people, that basic patience of hearing someone out is somewhere missing. There's a lot of anxiety. There's a lot of tension all over the place. So we see too many conflicts, much more than earlier, not just between children but also between adults. So there's a whole lot of conflict management which is required at all times, and also a lot of anxiety among parents. They're anxious of very, very simple things which did not really matter earlier. Why was my child standing in the sun for 3 minutes before he boarded the bus? So these are the kind of queries that sometimes are coming in. Or and why are they going for sports? Why are they just so used to being confined inside the house? And we're in a situation where we are now tackling these. I'm sure it's also about settling in. It'll take a while, and all these things will slowly sink in that yes, outdoors are equally important. In fact, very important for children. And also, yesterday I had a little girl, grade 8 student. She was so happy to be back in school that she had an anxiety attack, and we had to help her in the infirmary to calm down and be back, in the class. It took her half an hour to just calm down. Okay, I'm in school. I'm with all my friends. I'm really here. So those kind of things are happening, and I'm sure it will take a while. SEL has to be mainstreamed. So here we are. Let's take it forward from there.
So good point that you've talked about that even adults and everybody's actually gone through change, and we tend to focus on the children, but the caregivers also have experienced, and that means the parents and adults as well. So Kavitha, again, what's your experience been since schools have opened, and what are you noticing? How are people now? Rather than saying children now, how are people in generally different now?
So I completely agree with Dr. Amrita Amol that the general level of patience, I think, is reduced when it comes to dealing with people. There's a lot more, they're also more vulnerable emotionally. But one of the specific things that we've observed across our schools and is problems related to speech. And we've done quite a bit of work. We've been in touch with CMC, and in fact, CMC out of a survey said that speech-related problems in young children have gone up threefold during the pandemic. They're getting 3 times more cases, which was quite surprising. We thought, okay, maybe, is this like a broad spectrum thing? And it is, because young kids, when initially in the speech development process, when they haven't heard so many people physically seen those lip movements happen, they're developing problems related to speech, and we put strategies in place to work with kids on that. The other thing that I notice is earlier kids were okay to go to the school psychologist and talk out their problems. Now, because they've done it so much virtual, there seems to be a little hesitation in approaching the psychologist on campus. And hence, the other thing that we've done is we've given access to the psychologist still for online counseling and consultation post school hours, so they don't have that inhibition. At the same time, creating awareness on normalizing going to a psychologist or talking your issues with somebody and not being judged about it. But while that process is on of awareness, we've also ensured that there's a psychologist available to them online in case if they want to reach out. There is also this, I think, lowered, I don't know in what category should I put this, physical, emotional, but I see a sense of lowered integrity also in students. And when I say integrity, it is a little like, it's okay. The lack of discipline to get things through, because when they've been online, it was all right for them to turn off the camera. It was all right for them to maybe do open textbook assessments. But when they come back to school and when they're put through a more, I would say, monitored environment, they are very, very restless in that environment. They feel that they're put to task, which they were absolutely okay with earlier. So I think these are some of the changes that we're seeing, and we're working towards putting solutions for these. Yeah. Amol,
You're on mute,
mute.
Amol.
Okay, sorry. Next, I'd like to ask you, Basanti. I mean, you work with in the NGO sector, uh, and of course, Amrita and Kavitha are talking from the private school sector. How has it been for children who've not had this social interaction over the past 2 years, and they've been maybe confined to their homes? The homes that you run in that sense. So, how has it been for them as well? What changes have you noticed?
I would need more than 5 minutes to describe everything. I think all of us could actually speak about the challenges the children have faced and the changes that we have observed for hours. So just quickly to understand where I speak from, Tara is a daily-based NGO. We run children's homes where children have been placed, they have been victims of severe violence, trafficking, sexual abuse, and they stay with us 24/7. And those children are being mainstreamed in public schools. So those kids had access to online schooling. On the other hand, we also have community-based programs like outreach activities, where here we look after and support families and children who mostly go to governmental school. And the two types of children, if I may say, I've faced very, very different challenges. Because on one side, children who had access to because they were in public schools face what was described earlier, which is limited social interaction. So going back to school can be a little difficult, readjusting because they have to adjust to takes time, and now they have to readjust to normal schooling. So it takes time for them to adapt. Some of them have got a little addicted to screens. So the whole social development deeply impacted. Teenagers or for people need to develop this social skills very early. On the other side, enrolled for the last 2 years. So they face higher risk of child labor, higher risk of child marriage, and the risk of them dropping out completely is very, very high. So we are on two very, very different challenges. On one side, for children who have had access to education, it's mostly about readjusting to what we call normal life. But for children, education has been stopped for the last 2 years. It's mostly about bringing them back to education and making sure that they don't drop out today, but they don't drop out in 2 years. So that's a very, I think it's a long-term challenge that we have to address.
Thank you for that, and that's a different perspective that you're adding to the whole equation. So, Riddhi, I'm going to come down to you. So, we're talking about this is what practitioners are saying. What kind of cases are you observing? How is it different from the children that you maybe who came to you 2 years ago? So, what changes have you seen? Because now uh, everybody was talking about the macro level, at the micro case study level. Have there been some dramatic changes in the way children are now coming to you?
Yes.
Because Kavitha mentioned that children are not comfortable now going to asking for
Absolutely.
help.
I so agree with what Amrita and Kavitha said. So that is the scenario. 2 years back, children were so comfortable moving around, going to schools, meeting people, which is kind of stopped. The amount of cases I'm getting is kind of three, four, three. I think that's thrice in the amount I used to handle it before the pandemic. Majorly, there's a sudden spurge in the emotions, the bottled up emotions that the children are having. So they could see while the pandemic struck, everything was within the four walls of the house. So even if the parent had to went out, the children had to went out, they had no way other option rather than chillifying in the family within or within the family itself, right? Or bursting their emotions or bursting out many a times.
And there
Because
was a lot of stress in the families because of the
absolutely.
financial, people losing
Ab-
jobs, businesses getting impacted,
Absolutely,
right?
absolutely. So the scenario currently is that the children are bottled up with emotions and they have no avenues and they have no even clarity how to let go, how to remove it out of the system. Second thing is that what I'm observing is, and the amount of cases I'm getting is a lot of body image issues. Okay, so children are worried that after 2 years I'm going to school and I've already started, my height is the same, or I have gone too tall, I've gone a little more fat, I'm getting hair on my face, I have certain changes. The child says that I have certain changes in my body. Ma'am, would I be accepted? What if they start making fun of me? Would they laugh on me? The third very important thing, and what I would like to share here, is that children are not able to write, so the writing skills have gone low. Then they're not able to think creative. The things what they used to have it 2 years back, I see there's a tremendous change. Also, they prefer not sharing anything, not communicating, not talking to people within the family or outside as well. So while the education was online, it was completely one way communication that was emphasized upon, right? And because of that, I see that the children are not sharing, not talking. The social skills have kind of gone quite low. And now again they're starting after a break of 2 years, they're starting. It will take time for them to come. I'm sure the way they accepted the pandemic and they accepted the new normal, they're going to accept this as well, but that it will certainly take time. And I see a lot of sudden spurge in the mental health issues as well.
So then let me just start the second round of questioning with you only. Since you're a professional in this field and the rest of us are learning as we're going along. So what is your recommendation and for not only for how to deal with children, but how to deal with adults as well who are actually the same frustrations have come out after 2 years. So even adults are facing their own demons as well. At the same time, that means the teachers, the principals. So what should we all do? What is your recommendation being a practitioner in this field?
Amazing. So, Amol, just 7 months back, 10 months back, I had organized a roundtable conference. And while the NEP draft was released, and I have strongly emphasized from then to now, I have been strongly emphasizing to all the educators. In fact, the report has gone to the education ministry as well. The white paper has been raised that mental health should be a part of your daily routine in the class. And it doesn't take much time, it takes just 5 minutes. right? Maybe a shake off, maybe something wherein using a lot of expressive way art in the classroom works wonders for the educator and for the children. All right, you don't know what the child has seen while coming to school or before, a day prior, or even an educator has a lot of issues. Okay, so it is very important that you give 5 minutes and emphasize in this within the school premises 5 minutes on mental health and mental well-being of the child and the educator. There are a lot of versions while we use it. There's a lot of different versions and different ways that can be done. Primarily, I would emphasize more on expressive way of doing it, using movement, using music, using colors. And 5 minutes is just, you are there, so you are not thinking about the past and the future, but you are in here and now. And when an educator is in here and now, when the child is in here and now, there is magic going to happen within the classroom. Okay, second important thing that is very important for parents, educators, that you allow the child to talk. And when I say allow the child to talk is, um, let's not be judgmental to what the child is sharing. It might be as stupid as what we feel. It might not be stupid for the child, because the child is expressing. And it's very important to give a very non-judgmental space to the child to share and to allow to talk. When the child will start having this space, he or she will understand that what are the things that he or she is facing, or that is cluttered there in the mind or bothered about, and that's how they will get an avenue. And it's important that educators also notice that if somebody needs help, to put them to the right person within the school premises or outside the school premises. But a little more awareness on the educator side is certainly needed, and on the parent side as well.
Riddhi, can I just interrupt here? When you say outlets, and we talked about that the children are not sharing, so do you, recommend a kind of a one-on-one sessions? Because in a school we have time issues with limited staff, times, curriculum has to be finished. We already doing there's a lot of backlog to be done, or do you, suggest a kind of a group therapy, things like we have, we see the Alcoholics Anonymous kind of group settings. So what would work, and can our teachers equipped with the skills to manage this kind of, it's a very delicate thing to try and manage this. So, or do you think it should be handled only by the professionals?
No, the professional should be equipping the educators as well. It's a question of 5 minutes in the class. A simple activity like when a child comes to the class, we start our day with prayers. Okay, I understand that prayers are very important, but before that, there are a lot of other things which can be done. It's just a music can be on, a shake off can be done. While a child shake offs, let me connect it with, have you ever seen an animal been knocked off, or some dust has been thrown, or the mitti has been thrown on an animal, and the animal is there on the road? What the animal does, it he gets up, shakes off his body and starts moving. That's exactly what we have to teach a child, right? That how to shake off the things, how to move on, which is what expressive art teaches. And even educators, this is support. But yes, the educators need to be equipped, because if they are not equipped, they will not understand where the support needs to be given. Then the professional comes into picture, because where it's one-to-one or where it's one-to-group, that can be managed. But yes, educators need to be well equipped about these things. And it's small things. I'm sure they are wonderful people, they can manage.
Thank you for that, Amrita. For you now, I think we've got. You mentioned things about, you expanded the problem by saying it's not just the children; it's the adults as well who are equally, had a challenging time. And Riddhi's mentioned things about where we need professional help. So, do you think that there'll be a greater role for the school counselors already to deal with teachers and children, or how are you dealing with this situation now? What do you recommend that principals should? Where should they go for help now?
So definitely the counselors have always actually been important in a school, as per me, because I think, and UNESCO talks about mainstreaming SEL. So we in our schools have been having the EMC square framework for SEL implemented since a while. And the early childhood, we already have the EYFS. So the personal, social, emotional development is one of the key skills that we anyway focus on. As a part of this and habits of mind and the Castle framework, what's been happening is that there is a lot of, Riddhi talked about expressive arts is critical. There is a lot of graphic language used all the time, and adults as well as children use a whole lot of graphic language, and that is very, very helpful. So we have got the ateliers as per regio across various portions of the school, where people can just go ahead and in that graphic language express themselves. There are mirror spaces where people can just go and look at the mirror and blurt it all out, those bottled up emotions that we all talked about. And that space to talk, sometimes you can just talk to the mirror and feel good about it if you're not comfortable maybe with a human being, separate someone. So sometimes all those things help. And what we've done is we've added the morning circle time, which used to happen earlier in early childhood, grades 1 and 2s and stuff. Now that is all the way through till grade 12, the morning circle time and the afternoon circle time, and everybody just comes together, joins hands and talks about things. And mindfulness and empathy are part of the curriculum. They're not one life skills lesson which will happen once in a week or something. They are every day integrated into the curriculum. And I think all of us need to role model that behavior as parents, as teachers, and wherever needed. So it is, the educators meeting every child every day, and the educator realizes, okay, here is someone who seems to need some specific kind of help. So she connects with the counseling team, and there are quite a few of them now. So we have a whole team, and then she ensures. Sometimes the counselor knows that the child will be willingly coming to me. Sometimes the counselor knows that I need to make myself available at certain places where the child will be probably comfortable talking. So accordingly, when they look at it, so the professionals and the educators essentially do work as one team. And we have to also counsel the parents a whole lot more, because parents are obsessed about a whole lot of things. They're worried about performance. They're still seeing children sometimes, as a collection of percentages rather than children, whole beings, right? And with a heart and mind of their own, with choices of their own. Children also have taken a lot of ownership. I think we've always encouraged it, and during the pandemic, self-discipline became key to achieving anything. And I think that's a wonderful thing that's happened, that they are really, really self-disciplined in a lot of ways, which is helpful today to all of us. And so now it's about harnessing that sense, making them feel even better. We've got these honesty libraries all over the corridors. The idea is to create that culture of thinking, that environment where everybody is able to discuss freely, talk freely, share. When they are back, yeah, there are anxieties and all those things. But what I also see is they're sharing. And more than the kids who are in school, they are they're faster in terms of settling in. And within 2 days, I observe a whole lot of change. Third day is better, fourth, and so like that. But with parents, there's a lot more required. So my time now, as I see as a principal, if you ask me, is going more with parents, calming them down, holding counseling sessions through the professionals, sometimes ourselves, for them, and so on and so forth. Because they still need a whole lot of hand-holding and support in the entire process. We anyway have the social, emotional, and creative intelligences as the key aspects of the curriculum, and therefore, I think a lot of things have been smooth for our kids, and they're getting better. But we did realize that SEL has to be the main focus, and we add more. So we have, in fact, a lot of inventories are being used by my counselors, so that any kind of reporting or assessment that we do also, like we have resilience quotient and emotional quotient as part of our progress card. So that reporting also should be based on some certified inventory, and not just, somebody's random judgment. Okay, I think this child is good, or I think no. So no. So we've got those batteries in place, and those are being professionally utilized. So teachers are trained to understand them, but of course teachers can't administer them. The licensed practitioners can, and that is being ensured. Yes, it has added to the budgets, to the costs for the school, but I think it is central. And if a child is emotionally able to regulate herself, then it will naturally lead to, attention regulation also. It will naturally lead to better academic and sports and dance and music performances also. So all of that is all interlinked. Theatre is also a very integral element, and I think theatre has helped us through and through, even during the pandemic and now. So yeah, it's all adding up, and it's helping us in life.
Yes, thank you. Good points, Amrita. I think we can see that your point on that the adults uh, are equally impacted and need help as well. Kavitha, I'd like to go to you, and Amrita talked about us having that already as an integrated part of the curriculum, and because they are a self-owned school, so there's a greater control on the systems. You have a franchise network of schools and are in rural locations where perhaps is not that the teacher quality may not be that trained or equipped to handle situations like this. So how do you deal with it where you don't have that kind of tighter control that perhaps Amrita has on her school? So the challenge is it's a new thing that's happening, but yet how are you dealing with that?
Was that question for me, Amol? I got conked off. I
Yes,
just
yes, yes, yes.
came back in.
That's okay. Okay.
Okay.
Okay, so I'll just repeat that. I'll just repeat that. Amrita talked about how her curriculum is already integrated, has a lot of SEL elements in it, and how they are supporting the parents and the teachers and all. In a franchise network like yours and mine as well, this control is not so much direct. And of
True.
course, we both have branches in rural locations. How do you plan to, help the teachers who may not be as, aware, as equipped, as so? What do you do in the franchise network like that, and how are you helping the schools out?
Thanks, Amol. Um, so, apart from what Amrita said, like I completely agree that graphics and drama, role play goes a long way in getting children to express. But to address your question, one of the things that we've been doing for many years, but has been more useful this year, is a program called Teachers as Counselors from NIMH, National Institute of Mental Health. It's a certified program and it's beautifully designed to help teachers uh, recognize, identify emotional, physical, cognitive needs of children. They can't administer tools, they can't really provide remedies, but that identification helps, and then for them to connect with the counselor back and say, look, this is what I noticed in my class, and can you verify this? Can you observe the child in greater detail and give us remedies on how to deal with it? So a lot of collaboration between teachers, counselors, both at the school level and at the head office, we hired counselors full-time who are acting as supporting agents to the local school counselors and to the teachers, and also a lot of parent involvement. I completely agree with Amrita that um, parents the parent expectation with students is something that really needs to be moderated, right? They don't realize the cognitive gap, the learning development gap that the kids have gone through in this time, and they're still at that competitive thing. I'm not against a competitive spirit. Eventually, we are in a country where it's competition all around, but recognizing the child's current level and working with the child at that level. So I think training the teachers, creating this kind of a network between teachers, counselors at school level, counselors at head office, that is the corporate office, and then involving parents, having a helpline for parents to talk to the psychologists directly and not just to the academicians, has also helped. A few other small things that we've done within the classrooms and the staff rooms. For example, we put up these small wish trees and feel trees where teachers and students could post it. Today I feel, today I wish. It could just be a small, like I know students who have said, today I wish like beating up somebody. And we talk out to them as to why this
Yeah,
kind of a
this is what
feeling. Why do you
Riddhi was also talking about this, allowing expression in some way where she sort of talked about the 5 minutes, right? So, yeah.
Absolutely, and non-judgmental, permission. And I completely, I mean, this shaking off was a great takeaway, Riddhi. Thank you for that, and I'm definitely going to try that out in all my schools. Sounds very, very interesting, and especially the way you connected it to an animal shaking it off. I think kids can relate so beautifully to it because That's another thing we've noticed is that there's a lot of love for pets during the pandemic. A lot of kids have got pets at home, and we are able to talk empathy through that language. I'm not a great fan of pets myself, but when kids come and talk to me about it, it feels nice that, okay, they've been able to make some connect and they've been able to show empathy there, so we know how to relate it into the classrooms. But yeah, to answer your question, Amol, like I said, I think NIMH courses for teachers as counselors is brilliant, and I would advise all academicians, in fact, even parents, to attend it. It helps you empathize with students, with young learners so much, understand their challenges. Yeah.
Kavitha, for sharing.
Riddhi wanted to
Basanti.
add something, I think.
Yes. So, Kavitha, thank you. That's an activity which has been picked up from dance movements. I'm a dance movement therapist, and I work closely with students and parents using movement. And it's so strong that it allows a person to share. So, it's whether it's an adult or whether it's a child, movement helps to let go. And that's where I use this. Thank you so much.
Uh, Basanti, I want to ask you this question now. With limited resources, limited awareness, and you talked about the government school sector and the children who are less privileged. Where, what can school leaders, principals who are running the government schools, where can they go for help? I mean, we've talked because everything, even everybody admitted that all this is expensive, adds to the cost, hiring more professionals. So somewhere, and people are paying for them. But what about those people who do not have the resources? What kind of help can they go out to seek, or should the schools just integrate into the curriculum, or do you think there are some opportunities available outside? So because we have an audience of school leaders, so I think if you could shed some light on where they can go for help.
That's a very, very complicated question to answer, also because I am myself not running any school. Um, what I see in terms of needs, my fear that most children will be promoted to the next class. So let's say a child who was in class 4 2 years ago will be now in class 6, while his or her schooling has been stopped for 2 years. So I think the governmental schools need to come up with a modified syllabus so that the children are given time to cope up and to catch up. Because we have seen a drastic decline in their reading abilities and all basic abilities. So if they are just brought back to school and to a class that they don't have the level to follow syllabus, it's gonna have dramatic consequences on those children because the school were shut for 2 years. So if you are 8 years old child or 10 years old child, it means that his or her education is not that important. So now the schools are being open, and now we are all saying, okay, now you go back to school. But what is there? What is being done for them to feel involved again? To feel that they belong to the learning system as part of the schools and the government really need to work on that. How it's going to be done, I think greater collaboration with the social sector can happen, maybe with also public school, because obviously in terms of resources and in terms of expertise, modify a syllabus, to make adjustment. I think public school have greater expertise in that. And I think that the second responsibility of government is to reach out to children so that they can be mainstream back. Because I recently read a report from the UNICEF who mentioned that I think 10 million of girls were at risk of dropping out from secondary education. This will have, again, a devastating effect on child rights and on opportunities of children in our country. So I'm sorry, I'm not bringing a very concrete solution, but yeah, I think something needs to be done in terms of syllabus instead of reaching out to children who are at risk of dropping out. Just to conclude, I think the very positive impact of the pandemic is we have to find that now mental health issues are taken seriously. Being in the NGO sector, being in the school sector, I think now we are all aware that everyone can be affected by mental health issues, and I think that we need to really kind of free our speech about it, our ability to speak about those issues, and stop a bit the discrimination or the stereotypical attitude that we take with regards to people issues.
Amol, just to add to what she said, I think it's a great idea for private schools to reach out to government schools or students who are less privileged. And that's something that we do actively with all our schools. And I think that's helped our children humble down, tone down, channelize their emotions and expressions in the right way. So in fact, during post-pandemic, when school started, we got all our schools to adopt either an orphanage or a government school, and students to work with these kids. And that's really gone a long way in channelizing our own students' emotions. At the same time, community collaboration for them to understand that the problems that they are facing aren't, I mean, I would not undermine their problems, but there are different set of problems that are being faced by different set of group, and they could work together to collaborate and find solutions for each other. So, and also the government has a lot of resources. Like I said, NIMH program, it's free of cost. They don't charge anything for it. And there are a lot of other such, like in Hyderabad, we have another, I'm sure every state must be having mental health centers for students who are offering a lot of free services for schools. If you approach them, they are willing to talk to parents, they are willing to train teachers, they are willing to reach out to students. In terms of, in fact, CBSE, like she said, because there is a learning gap, the essential concepts document that CBSE released, I think was such a beautiful document to help parents understand what is the bare minimum my child needs to know. Help teachers understand this is the bare minimum I need to cover instead of focusing on covering the entire syllabus. So the awareness to these, I think, lacks with a lot of rural schools, especially because they're not connected. They don't know that such help is available. And I so wish there was some platform where all these resources were available to them at one click, and they could, because it's a lot of search for you to find these resources, right? But I wish there was some place where they could, maybe it's a good idea. We should all curate a platform together where all these free resources are available to schools. On mute, Amol.
Yep. Okay. Riddhi, I want to just go over to you with this question about where can schools go for help beyond, because even for the private school sector, they have one counselor, they got 3,000 children. So definitely, like Kavitha has been sharing some things, so I'm sure you can put on some more light, which will be very useful for the audience today, as to school leaders, what all else we would recommend that they can go for help.
Wonderful. So, Amol, as much as the educator skills are focused throughout the year for academic skills and subject related skills, um, there have to be skills upgradation when it comes to mental health as well. So first point of contact is educators. Second, instead of having one counselor every stage, is like first to third standard, fourth to sixth, nine to ऐसे करके, in three spheres, if you can have two counselors, there is a enough bandwidth and availability of counselors to the children. Also, there can be remedial centers been created within school premises wherein they can support. So you can have visiting people, faculties who can come there, do small sessions for the children, for the educators, to create more awareness. It is just not about that they have ADHD or the child is having trauma or grief. mental health is much beyond that. So we are not talking about disorders at the moment, we're talking about mental health. So when a child is having grief, even stress, even trauma, or non-acceptance of self, or low self-esteem, everything can be addressed at the school level. Okay, so this is something which can be done. I feel that the school should be open to having mental health practitioners who are in the private practice, can be a part of the school setup once a week, or 15 days, like maybe once a fortnight, who can come address some grave situations which the school counselors are unable to solve. So that is perfectly okay. I also feel that regular upgradation, as I just mentioned about the educators, there has to be a space for even regular sessions for children, when it's one to many can be arranged, and maybe some conferences where there is awareness been spread. So the school can take up, while the annual day we have about dances and music and all, maybe 2 hours be given for such awareness programs as well, to spread more and more awareness about mental health. Because as much as it is needed, there is still, in our country, it's a taboo, and people feel that you don't have a problem, why should you go to a psychologist? So I think to normalize it much, awareness session needs to be arranged within the school premises, and when the school will start talking about it as something which is needed, the parents will accept much more than what they're doing at the moment.
May I just add to that? Yeah. So, Amul, you're still on mute though. Okay. So just absolutely, agree with Riddhi that there is a whole lot of work that is required at the school level to create this awareness. It's not just that people don't want to reach out to a psychologist for help. It's also that everybody considers themselves a psychologist. Okay, psychologist, I can treat you, stress, that's not a problem, we can deal with it. So that is very much there. So everybody pretty much is like, okay, everybody's willing to give advice and support. So it's important to understand that when there is some sort of a chronic stress, it is something that does need treatment and does need professional support and help, and it is okay to reach out. So there's a lot of work that, yes, schools do play in this. And I absolutely agree with Kavitha that collaboration of children with children in different kinds of situations and circumstances is really critical. Even within the schools, thanks to the RTE, we do have EWS children. Many of these children, despite all the efforts that we as schools may have done during the pandemic, many of these children moved to villages and other parts where there was no connectivity, or even if we gave them the devices, they were not. So a lot of learning loss is happened, which is very wide compared to the other children who were being able to, get access to everything. So this kind of work where children have collaborated and they've adopted one child and they're supporting, they're doing some co-teaching every other day in the premises, that is really helping. And that sense of empathy, that sense of compassion is coming out from both sides. Both the sides, the children are feeling that and they're talking about it, and that's helpful. The other is, I think, a whole lot of negativity is there for a lot of reasons. People are stressed. It's important for us to kind of create positive environments, lots of specifically focused areas for positive thinking, for thinking thoughts which are nice and happy, because everybody needs to be happy at the end of the day. Only then the rest can happen. So we have, so wish tree, we call it the kalpa vriksha, very similar to what Kavitha mentioned, uh, is there one way. But then we also have ensured that there is a whole lot of gratitude. So there are gratitude journals and appreciation mugs. So on every teacher's desk, there is a little mug in which everybody is supposed to put at least 3 cards for any 3 people across the campus. And all the, section heads have been assigned this duty to ensure that anyone's mug, if it's not filled for that day, you got to go fill it with something positive that you have to write about that person. So every day, everybody goes back home, and then morning when they reach inside the campus, they look at their mug, what's for me today? And so do children in their attendance pocket chart. They write for each other some note of, you did this amazing and I want to thank you for this. So their gratitude and what wonderful things happened today. So it's just about moving our focus from all that is stressful and tough and negative to shifting it to something that's wonderful. There is so much wonderful also happening around us. So that is really working well for us.
Brilliant. Thank you, Amrita. And you got lots of likes from the audience as well for your suggestions. And I think Kavitha also gave, on Riddhi also, you've given some wonderful suggestions that practitioners to do. And I think what comes out of it is every child is going to be unique. What works for one child may not work for the other child. We have, as educators, we need to create maximum platforms for things to work, whether it's a pet that works for somebody, whether it's a uh, going with the lesser privilege. And as Riddhi talked about that stigma of, if somebody gets hurt, everybody calls on them, "Theek ho na, how are you feeling now?" And if mental things happen, then people are, "Are daru piyo, theek ho jayega, kuch nahi," kind of answers you get from if you're feeling sad. So I
Amol,
think,
thankfully not for kids yet.
yeah, not the kids yet, yeah, but for adults, because Amrita
Thankfully
did
not
raise a
for the
point about
kids
adults,
yet.
not
No,
for
no,
the
no,
kids
no,
yet.
no, 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 no. Believe me, the number of drug abuse cases and things like that are really
In the
increasing
adolescence,
across
yes,
schools.
yes, absolutely.
Yes,
Yeah, I
yes. So
agree.
we have to be careful even on
So,
that front.
I will take this opportunity, Amol, just 2 minutes. That while we're talking about, as Amrita and Kavitha rightly said, that substance abuse is increasing day by day. Even in last 1.5 year, my office noted around 73 cases of attempt to suicide and 31 around, which I don't cater to, but 31 cases of suicide, and the age group has been 12 to 15 years, which is little alarming because they are too young to even think about all this. Okay, so as much as we are trying to say that this awareness needs to be done, we have to have it at a jet speed now.
Yeah.
uh, all this is the impact of the mental health which has not been controlled, and there's no outlet, children feeling helpless, and maybe for them, so suicide seems the only way out. And uh, Basanti, I want to talk to you about this. I mean, and you've talked about this as well, that yeah, the impact of a lot of people getting into poverty and the stress of the COVID in terms of the economy, jobs, child labor is increasing because of this. Since we've talked a lot about the private school sector, the privileged kids, and as well. But what is going to happen? Have we lost half a generation? And will the impact, you think, of this, even if as a best case, if this is the end of the pandemic, but still, do you see the impact of this in societies around the world, in developing countries around the world, that this COVID generation, so how so-called, will have those long-term impact, or do you see that? Do you feel kids are more resilient than we feel, and they are going to bounce back, and it's going to be we can heal this, or do you think this is a permanent damage that is going to be there in the society?
I hope it's not. I agree with Dr. Amrita. I think we need to keep positive, and I think we are aware of the challenges that we are facing right now. I think we should be honest that the school closure for 2 years will have a very long-term impact on a generation if we do not address it. Now, I'm a firm believer that problems can be addressed and it's never too late. I myself, see transformation in children who have been victim of very severe traumas, and once we actually give them attention, give them enough care, and listen to them and let them express themselves, that those children have the resilience and the ability to overcome a lot of challenges. So I've witnessed this for the last 12 years in the children we look after, and I think in terms of education, we should just all feel responsible for the learning loss that we have been talking about today, and make sure that the issue is properly addressed, that concretely addressed. So I think it's a matter of political responsibility and individual responsibility as well.
Because I was reading your website and Tara, the work that you've done where children who've gone through extremely traumatic situations, how they are performing well in schools now. And so,
Yes. That's sorry to cut you, but
yeah.
that's what we see. That's what we are able to achieve. We recently got a 19-year-old child who was admitted in Canada, and he just got admitted in NID, Ahmedabad, and this was during the pandemic. So children have resilient skills. That's very clear, but they need to be explained what's happening. I think what worked beautifully for us during the pandemic is that we had to tell the truth to the children that we did not know. We did not, at the very beginning of the pandemic, nobody knew what this virus was about. We did not know how long will it take, and we just kept updating the children with how the situation was evolving. And I think it's very, very important as adults, as caretakers, parents, teachers, that we explain to children what's happening, because that also enables them to cope up with the situation. We sometimes, I think, as adults, think that we know better and we know how to take the decision, that children need very limited information. I believe in the opposite. And I think, especially in situations where there's a lot of, a lot of things are uncertain and stressful and scary, this needs to be talked about. And that's how we equip children to deal with life and also to develop an emotional intelligence. So, again, the long-term consequences depend on how we see the children today and how we, as a collective, as a society, hope for something better.
Thank you, Basanti. Some good hope, lots of words of hope, and I think we've all talked about and Amrita talked about the positivity, about creating happy environments for everybody. So I think with that note, I think it's going to be, and the way you said it, that we need to tell the children that we don't know, but we are working with you, and I think. So once, okay, this is weird. Okay, so let me just, thanks everybody for sharing your practical tips on, I think what we're all talking about is showing children that we care, and if, as long as they see our sincerity, please keep nodding your head so I know that you're listening to, you can hear me. I mean, otherwise I'll be talking without. Okay, fine. You got the joke, so you can hear me. So I think it's about caring. I think we need to all care, share, and that's what's been this session has been all about, where everybody shared some wonderful tips, and thank you all for doing that. And hopefully, as Basanti shared, children are going to be more resilient than we expect. So as long as we tell them that maybe we don't have the answers, but we care for you and we're there for you and we'll help you out, I'm sure we'll be able to undo a lot of the damage that the past 2 years have done. So thanks everybody for being a part of this panel.
Thank you so much.
Thank you.
Thank you so much.
I also just request you only for 2 minutes. We have some questions in the Q session. Really request you to take a few of them. So there's a question by Pragya who's asking how teachers are doing more than just the role of facilitators in a student's life. I would request any of you to please help Pragya with the answer. Amol sir, would you want to take it
may
up?
I?
Oh, Amrita ma'am, sure. Thank you.
Yeah, okay. See, teachers are the first, the mother is the first teacher, and then all the other teachers are with the mother role models and the father. So teachers are every day, so they're the messenger, is the message. The way the teachers are, the way they walk, they talk, the way they dress up, every little thing, every little aspect of a teacher matters to a child and makes a huge difference at every age group. And that's where teachers' role is as a facilitator. And now I don't call it facilitator. We are actually co-learners. and with children, if we are collaborating and learning every day, I think that's the way children develop and learn to take ownership of their own learning. And if a teacher is able to see the child as a person with their own ideas and thinking and their own right as an individual, that is when real learning actually happens, and that is when co-learning actually happens, and student choice and agency actually comes through.
Thank you, ma'am. Thank you. I would also move ahead to the next question. Any advices that will be help to all the caregivers? This is a question asked by Miss Muskan Mutkal.
Can I
Yeah,
take this question, Asmita?
yeah,
So it
sure,
is very
ma'am.
important for all the caregivers to be mindful about your own mental health as much as you're mindful about your physical health. It is important that you take your your monthly sittings with your peers or your seniors. It is important to do that. Also, it is not that when we are caregivers or we don't have any issues, we will have more, because sometimes we might fail to have a self care on place. So we are more prone to having mental I would say mental well-being might be more affected than others. So it is very important that you are mindful about what you do, how you do, and regular working on yourself regularly, and regular sessions will help you to support yourself and support hundreds of other people. So it is important that you take care of yourself because you are special.